So according to your routine, what is the topic for today? Typical thoracic vertebra, okay? So before studying the typical thoracic vertebra, we should have certain understanding about the vertebral column, okay? So the vertebral column consists of what? Vertebra, okay? So do you know any other name for the vertebral column? Spine or spinal column, okay? So the vertebral column, what is its function mainly? Protects the spinal cord. Then it helps in transmitting the weight of the upper part of the body to the lower part of the body, okay? So now, and it also forms the central axis of the body, okay? Now there are how many vertebrae in our body? 12 is thoracic vertebra. In total, how many vertebrae? See, this is the vertebral column. See, this is the total vertebral column, and each one of them is the vertebra, individual vertebra. So in total, how many vertebrae are there? 33 vertebrae, okay? So the whole vertebral column is further divided into cervical vertebra, thoracic vertebra, lumbar, sacral, and coccyx. Now how many cervical vertebrae are there in our body? 7. How many thoracic? 12. Lumbar, sacral, and coccyx? No, 4. So in total 7 plus 12, 19 plus 5, 24 plus 5, 29 plus 4, 33. But in case of adult vertebra, it has been seen that sometimes the sacrum and the coccyx, they get fused. So these 5 vertebrae and these 4 vertebrae together gets fused and form 1 each. So and some other vertebrae also sometimes get fused due to some conditions. So sometimes it has been seen that in adult vertebra there are in total 24 vertebrae, but you don't need to remember this thing. Only 33 you remember, that there are 33 vertebrae in a human body in total. Now, do you have any idea about the spinal nerves? Have you heard of cranial nerves? How many cranial nerves are there in our body? 12 cranial nerves, okay? So similar to cranial nerves, we have spinal nerves. So CNS, central nervous system. So the whole nervous system of our body is divided into central nervous system and peripheral nervous system. So our main consideration today will be on the central nervous system. So in central nervous system, there are 2 main important parts. One is brain, another one spinal cord. So from brain we get all the cranial nerves. While studying brain, you will see that there is pons, medulla and midbrain. From those levels, almost 10 out of 12 nerves originate from those regions, and some of the nerves originate from the olfactory bulb as well as the optic canal. So leave this cranial nerves. From the spinal cord we get spinal nerves. Now the brain is protected in a cavity or in a bone. What is the name of the bone? Skull. And similarly the spinal cord is protected in vertebral column. Okay. So this is the main difference between these two. And the whole, both of these together form the central nervous system. Now coming to spinal nerves proper. See, ideally the spinal nerves are named after the vertebra. So there are cervical vertebra C1, C2, C3. Similarly spinal nerves are there C1, C2, C3. Similarly thoracic spinal nerves are there which are named as T1, T2, T3. So ideally for 33 vertebrae we should have 33 spinal nerves. Cervical 7, thoracic 12, lumbar 7, sacrum 5, lumbar 5, sacrum 5, coccyx 5, coccyx 4. So in total 33 spinal nerves should be there. But it is not the case. Because in case of spinal nerves, starting from the cervical. Suppose this is your cervical vertebra, C1, then C2, similarly C3, C4, C5, C6 and C7. Now the spinal cord is passing through this part like this, through the vertebral foramen. In case of C1, the spinal nerve, obviously it is originating from the spinal cord, so it originates from the upper surface of the body. I mean from the upper surface, it passes through the upper surface of the C1 vertebra. So it is known as C1 spinal nerve. C1 spinal nerve. Similarly, in case of C2, it passes through the upper surface and it is known as C2 spinal nerve. Similar for C3, C4, C5, C6 and C7. Other than C7, there is C8, the 8th cervical nerve, which passes below the C7. So this is the 8th spinal nerve which passes below the C7. So we got how many spinal nerves in case of cervical? 8 spinal nerves. For 7 cervical vertebra, there are 8 spinal nerves. In case of thoracic, it follows the same pattern. In case of cervical, the nerves are coming through the upper surface. So at C8 level, it passed through lower surface. So from thoracic part, it again keep on continuing through its lower surface only. That is T1 spinal nerve passes through the lower surface of T1. Similarly, T2 passes through the lower surface of T2. So in case of thoracic, there are 12 spinal nerves only. 12 thoracic vertebra, 12 spinal nerves. In case of lumbar also, similar pattern, 5 spinal nerves. Sacral, we have 5 spinal nerves. So how many we got? 20, 25, 30. In case of coccyx, we have only one coccygeal nerve. Only one coccygeal nerve. So in total, we got 31 spinal nerves for 33 vertebra. Okay? So in thoracic, lumbar and sacral, the number of vertebra corresponds to the number of spinal nerves. Each nerve is lying below the corresponding vertebra. This is for thoracic, lumbar and sacral. But in case of cervical vertebra, 8 spinal nerves are there, 7 coming from above the corresponding vertebra and the 8th one is lying below the last vertebra. And in case of coccygeal, there is only one spinal nerve. Now, classification based on motility. What do you mean by motility? Movement. It has been said that which vertebra are motile and which are non-motile. So you can turn your neck like this. So cervical vertebra is motile. Now you can twist your upper trunk like this. So your thoracic one is also motile. And you can bend forward like this as well as you can stand like this. So your lumbar one is also motile. And which are non-motile? Sacrum and coccyx. These are non-motile vertebra. Okay. These are fixed vertebra mainly. Now the length of vertebra in males is 70 centimeter and in case of females it is 60 centimeter. And the intervertebral disc, they occupy almost 1/5 of the total vertebral column. So in case of males, the intervertebral disc, they together forming 14 centimeter. 70 if you divide it by 5, 1/5 of it is 14 centimeter and in case of females it is 12 centimeter. Now see this thing. So basically, in case of the vertebra, the width of the vertebra keeps on varying. Okay. Suppose this is your cervical vertebra. It is going on to be wider and wider. Then it is again becoming narrow. And at this level, at the level of T4 and T5, it has the narrowest part. Okay. Then again at the lumbar region, after T5, there is T6, T7, T8, T9, T10, T11 and T12. It is going on becoming wider and wider, and at the coccyx level it is again becoming narrow. Now the problem is this: in this portion at between T4 and T5, suddenly after becoming wider and wider, this has become a bit narrower. So to transmit the weight in the lower part of our body, there has to be certain kind of compensation here. So this compensation is carried by the sternum and the ribs. So in this part, you have the sternum in the front and ribs coming like this. See here. Here at the T4 and T5 level, here at the T4 and T5 level, it has become narrow. So the sternum in front and ribs coming from front to backward, both of them are supporting the whole structure, thus transmitting the body weight to our down part. And as you can see, due to this varying width, the whole vertebral column can be divided into 4 pyramids, 1, 2, 3 and 4. Now curvatures. So basically at our birth, you will see that a baby looks like this. I mean the vertebral column of a baby looks like this. This is basically your primary curvature. Primary curvature. What happens in this? This is your cervical part. This is your thoracic part, lumbar and sacrum. You will see that the cervical part is straight. I mean there is no bend. But in case of thoracic part, there is a concave bend forward. In case of lumbar part also, it is almost straight. But in case of sacrum part, it has a bend. So there are 2 primary curvatures in a in a baby when it is born. Okay, these are known as primary curvatures. This is mainly due to the intervertebral discs. Vertebral body. This is because of the vertebral bodies. And there are secondary curvatures. So when a child tries to hold up its neck, so this cervical vertebra will become a bit convex like this. Okay. And the thoracic will be as well as concave like earlier. And this occurs at 4 to 5th month after birth. This cervical one, thoracic is straight, and this lumbar one, when the child tries to stand up in an upright position, it becomes convex. This occurs at 12 to 18 months. So in pediatrics, you will be studying about developmental milestones. In developmental milestones, there are certain gross motor development, fine motor development. Fine motor development will be like pinching, like writing. These are fine motor developments. Gross motor is like making the neck upright, then walking. These are gross motor developments. Then there are certain social developments such as smiling after looking at a stranger, smiling after looking towards mother, then father comes, then other relatives comes. These things are social development, gross motor development, fine motor development. These things you will be studying in pediatrics. So this I am talking about the gross motor development. Okay. In gross motor development, you will see at 4 to 5 months, the child tries to make its neck like this. So it tries to hold its neck. So then this development will take place at the cervical vertebra. And in 12 to 18 months, it will try to stand. Okay. So these are known as secondary curvatures. See, this is your primary curvature. Your thoracic and sacral, this is a bit concave forward. And in case of secondary curvature, the cervical one becomes convex and the lumbar one also becomes convex. Now coming to coronal plane. So this is your sagittal plane. When your body is divided into 2 halves, this is known as sagittal plane. Coronal plane is like this. When it is divided into forward and in 2 halves, anteriorly and posteriorly. So in coronal plane, you will see that the thoracic vertebra part, it is having a concavity towards the left side. Okay. It is having a concavity towards the left side. What I am saying, like, first of all, this is the cervical vertebra. Then comes the thoracic vertebra like this. It has a concavity towards the left side. This is left, this is right. Then the sacrum and the coccyx. So this concavity is due to, mostly it is said that this is due to more use of the right arm. Okay. More use of the right arm as well as the arch of aorta. These are certain basic facts which you need to know. Now coming to the parts of a typical vertebra. So first of all, let us try to understand the parts of a typical vertebra through a drawing so that we can remember. First of all, here comes the body. This is the body. Okay, this is the body of any vertebra. You will see this body. Now from the posterior lateral part, two bones will be coming like this from either side. One bone through this side, another bone through this side. These are known as pedicles. So this is your body. These are your pedicles. Now now the pedicles becomes continuous with another vertical bone, that is your lamina. These are your lamina. So in a vertebra we have a single body and two pedicles, two lamina. Now these two lamina in the posterior part becomes continuous like this and form one process which is known as spinous process. This is your spinous process. Now from the junction of pedicles and lamina you have another process coming like this, which is your transverse process. This is your transverse process. Okay, now this is nothing to take a picture of it. So this is your vertebral body in proper. Now from this body part you will see, not from body, from the junction of the pedicle and lamina you will see one facet like this, one articular process like this. This is your superior articular process. Okay, I am like you are seeing the vertebra from above, so here you will see two superior articular processes, and on the inferior side you will see, just below the lamina you will see inferior articular process. This is on the lower side. What are the function of this articular processes? This superior articular process will be articulating with the inferior articular process of the vertebra above it. Okay, and this inferior articular process will be articulating with the vertebra lower to it. Okay, now in the body, at the lateral part of the body there will be certain facet on the lateral part. These are facet for your costal ribs. So ribs will be coming like this and attaching with this facet, and these will be present mainly in your thoracic vertebra, because the ribs attach with the vertebra at the thoracic region. Now let us see one by one these things. See, this is your body. Here is your vertebral foramen. This is your body. This is your vertebral foramen, and here comes your pedicles. Here is your lamina. Both of these lamina together form the spinous process, and on either side you got the transverse process. Now in case of only thoracic vertebra you will have superior costal facet like this. Why superior costal facet? We will see later on. Mainly demifacet. These are demifacets, and here for facet for tubercle of rib. These are the superior articular processes. Okay, superior articular processes. So these are your superior articular process. These are facet for articulating with the vertebra above it. See, this is your superior articular process, and here is your inferior articular process. Let us see in a vertebra. So this is your vertebra. Here this one is your superior articular process on both sides. Both of them will be having one facet each, and on the lower part here you will see the inferior articular processes. So the inferior articular process mostly they originate from the lamina. So this is your lamina, this is your pedicles, this is your body. From the body you are getting the pedicles and then the lamina. This is your vertebral or neural arch. So from the junction of the pedicle and the lamina, you got the superior articular process, and on the below part, just from the lower part of the lamina, you got the inferior articular process. And this superior articular process will be articulating with the inferior articular process of the above vertebra, like this. So this is your inferior articular processes, this is your superior articular processes, they will be attaching like this. Okay, and in between them will be your intervertebral disc. Now one thing I have left, pedicle and lamina together they form the neural arch or the vertebral arch. This pedicle and lamina together they form this part. This part. This is your vertebral arch or neural arch. Now the vertical diameter of the body, see, this is the vertical diameter of your body, and this is your pedicle. So the vertical diameter of the body is, more vertical, in length it is more than the vertical diameter of the pedicle. So the pedicle has a shorter vertical diameter than the vertical diameter of the body. Due to this, you got here one notch. This is your inferior vertebral notch. And on the superior side also there is a shallow notch which is known as the superior vertebral notch. What is the function of this? So basically, when two vertebrae joins like this, and in between them there will be intervertebral disc also. So both of this notch join together to form a foramen. This is one foramen. Through this foramen, dorsal and ventral rami or dorsal and ventral part of your spinal nerves comes. So these spinal nerves that come from the individual vertebra such as C1, C2, C3, these things, all of them have dorsal part and ventral part, subparts. Okay, these subparts come through this intervertebral foramen. Okay, so this foramen. Now thoracic vertebra proper. So as I have already said that thoracic vertebra is identified by the presence of costal facets for your ribs. So what is another name for ribs? Costa. Okay, so it has facet for the ribs, so it is known as costal facets. Now costal facets may be two or only one on each side depending on typical atypical vertebra. Now typical thoracic vertebra are the vertebrae starting from 2 to 8. Second, third, fourth, fifth, sixth, seventh, eighth. These 7 vertebrae are the typical thoracic vertebra. So what we have got, there are 12 thoracic vertebra. Out of this T2 to T8, these are your typical thoracic vertebra. Typical thoracic vertebra. And atypical are your 1, 9, 10, 11 and 12. This atypical vertebra will be taken in another class in your next Monday, and today we will be starting only this typical vertebra. Basically this atypical vertebra, for example, the first vertebra, it has features of cervical vertebra. Though it is a thoracic vertebra, but it has certain features of cervical vertebra. Similarly, this vertebra also has certain features of lumbar vertebra. We will be studying this in subsequent classes. Now coming to various parts of your typical thoracic vertebra. So this is same to your any vertebra. There are certain minor differences. For example, the transverse process of any vertebra usually has two elements. One is transverse element, another one is costal element. But in case of most of the vertebra, both of these elements are a single element. So we don't consider the costal element. But in case of thoracic vertebra, we have a separate costal element here. That is one difference. And another difference is the transverse process in a thoracic vertebra will be much more longer than the other vertebra. So this is your transverse process. This process, you will see that these are more wider as well as laterally placed than the other cervical vertebra or the lower vertebrae. This is another point. And this spinous process in case of any vertebra, they are mostly placed not posterior, yes, directly posteriorly and slightly downwards. But in case of thoracic vertebra, they are completely downwards, almost downwards, make very narrow angle in between. Okay, they are almost downwards. See, in case of the cervical vertebra, they are more like pointed. But in case of this thoracic vertebra, they are placed totally vertically downwards. See here, these are totally downwards like this. Can you tell me that what is this bone on the back of your neck? There is a bone, sharp bony projection on the back of your neck. What is this? This is the spinous process of your C7 vertebra. So you will be studying the cervical vertebra. In cervical vertebra, this is the C7 process. This C7 spinous process, this forms a bony projection on the back of the neck. Now coming to the costal facets. See, at the body, this is the body of your vertebra. We are viewing it from the lateral aspect. Now this vertebra, at the superior part we have one costal demifacet, and in the inferior part we have one small demifacet. Why these are called demifacet? Because they will be forming a complete facet when the vertebra from above will be coming. So how will it form? So when T4 vertebra will be coming from above, so T4 vertebra, T5 vertebra. T4 vertebra will be having a inferior demifacet like this here, inferior demifacet, and here will be in the T5 vertebra there is a superior demifacet. In this superior demifacet of T5 vertebra and inferior demifacet of T4 vertebra, we will get a complete facet like this, where the head of the fifth rib will be articulating. Head of the fifth rib will be articulating here. Okay, and in this inferior part of this T5 vertebra, some portion of the head of the sixth rib will be articulating, because in this inferior costal demifacet, ideally the lower rib articulates, and the superior costal demifacet, the corresponding rib articulates. So in the superior demifacet of the T5, the head of the T5 will be adjoining or articulating. Similarly, in the transverse process, the tubercle of the vertebra will be, corresponding vertebra will be articulating. So here the ribs will be going like this, coming like this and joining like this. Here will be the head, here will be the tubercle, and the ribs will be coming like this. Okay, now the typical thoracic vertebra, you will be studying that. To differentiate the cervical, thoracic, lumbar and sacral as well as the coccyx, there are certain points. There is a table in any book you will see. So one of the differentiating point for thoracic vertebra is that the body is of the shape of a heart. You will see the thoracic vertebra will look almost like the shape of a heart, like this. Okay, so it will look like this. See here, this is almost like the shape of a heart, na? So this is how the body of a thoracic vertebra is present. Similarly, in case of cervical vertebra, it is of kidney shape. You will be studying in subsequent classes. In case of cervical vertebra, you will be studying, there is another foramen, transverse cerium. So through this foramen also certain cervical nerves as well as artery passes. These are not present in thoracic vertebra. That is known as foramen transverse cerium. Okay, in the upper sixth costal vertebra, I mean the costal facet, in case of T1 to T6, they have costal facets. These are concave. Okay, in case of T7 to T10, the costal facets are flat. In case of T11 and T12, there are no costal facets present. Okay, Now coming to certain attachments. So in case of the thoracic vertebra, you will get at the anterior surface of the body there will be attachment for anterior longitudinal ligament, and on the posterior surface of the body you will have attachment for the posterior longitudinal ligament. Okay, and just in front of this is your lamina. Okay, this is your lamina forming this spinous process backward. So in the anterior surface of your lamina will be having your ligamentum flava. Okay, ligamentum flava. And your transverse process will be having 4 attachments. One is superior costotransverse ligament present on the lower part of the transverse process. Inferior costotransverse ligament will be present on the anterior surface. Then there is lateral costotransverse ligament present at the tip of the transverse process. Levator costa muscle posterior to the transverse process, and there is another costotransverse ligament in between the transverse process, that is your intertransverse ligament, this one in between the transverse process. Okay. From the spinous process we have another attachments. One is the supraspinous ligament, another one is interspinous ligament. Obviously supraspinous ligament will be present superiorly and interspinous will be present in between the spinous processes. Okay, now there are certain other attachments also at the spinous process. One is your latissimus dorsi muscle, another one is your this serratus posterior muscle, that is not serratus anterior. Serratus posterior muscle has certain attachment points at the spinous process. Then serratus posterior inferior muscle, serratus posterior superior muscle, and many deep muscles of the back. These have attachments at the spinous process. Now coming to ossification centers. There are in total 8 ossification centers in the total life of a vertebra. 3 primary centers and 5 secondary centers. Okay, the 3 primary centers, one will be arising from the centrum. This is your centrum. Okay, and 2 will be arising from your neural arch. So this neural arch is formed by your pedicles and lamina. Together they form this neural arch. Okay, so 1 arises at the centrum, this is known as your centrum, and 2 arises at the neural arch. These are your primary ossification centers. And secondary ossification centers, they will be arising 2 at the superior and inferior surface of your body, 2 at the transverse processes, 1 at the spinous process. Okay, so in total 1, 2, 3, 4 and 5. Now these primary centers, they are present at birth and they get fused. This first centrum part get fused by 1 year of life, and this neural arch primary centers, they get fused by 5 to 6 years of life. And these are the secondary centers. They start starts originating at 15 years of life and get completed by 25 years of life. Okay. Now coming to certain clinical anatomy part. Okay. First of all, spina bifida. Spina bifida. So basically this is due to failure of fusion of the 2 halves of neural arch. So this is your vertebra, this is your pedicle, then lamina. So together they form this neural arch. If there are 2 primary centers at the neural arch, so if one of them don't form, or they form it like not form together, so then there will be 2 separate halves of this neural arch. This is known as spina bifida. Okay, and sometimes this body, this centrum part, will have, instead of 1 primary center, there will be 2 primary centers. So what is the problem with these 2 primary centers? That if both of them don't fuse together, don't fuse at the same time, then there will be hemivertebra. That is, one part will be formed, another part will not be formed. Due to this, hemivertebra will occur, which will result in lateral bending of the spine as well as scoliosis. This is known as scoliosis. Let us understand this thing. Now, in between, as I have already mentioned, in between the vertebra, there is intervertebral disc. So this is your vertebra. Okay. Transverse process. So in between the body of two vertebra, there is one intervertebral disc. Okay. So these intervertebral discs are formed by two elements. First one is the annulus fibrosus. This is your annulus fibrosus. And in between them there is nucleus pulposus. Nucleus pulposus. Now up to 20 years of age, there is no problem. This whole intervertebral disc, these are very strong. But after 20 years of age, what happens? They become this annulus fibrosus part. This annulus fibrosus part, it becomes weaker. And due to this part becoming weakening of this part, any strain occurring at the vertebral column, for example, any accident or any while weightlifting, so while doing these activities, this annulus fibrosus becomes weak. Now weakening, there becomes breakage of this annulus fibrosus. Now this breaking of this annulus fibrosus up to this level also there will be no problem. Okay. Now problem starts when this nucleus pulposus comes out of this intervertebral disc. After this nucleus pulposus comes out of this intervertebral disc, it will compress the spinal nerves coming outside like this. So spinal nerves comes out like this. It will compress this spinal nerves. Now due to compression of the spinal nerves, pain will be transferred to the lower part of the body. Okay. Now these things happen mainly at the L4, L5 level. At the L4, L5 level. Okay. Now at that level, you will be seeing lumbar nerves originating. These lumbar nerves together form the sciatic nerve. So you will see that in disc prolapse, mostly sciatica takes place. Okay. Sciatica occurs mostly in disc prolapse because this disc mainly the most of the weight is beared by this part of the body. This is your lumbar vertebra. So you will see that at the level of L4, L5, this is the level of L4, L5. Okay. This is your L4 lumbar vertebra. L4 lumbar vertebra. This is your L5 lumbar vertebra. So at the level of L4, L5, when nerves comes out like this, they get, nerves comes out like this and the nucleus pulposus presses on these nerves and in return, the pain gets transferred through the sciatic nerve to the lower part, to the lower limbs mainly. See, this is how the spinal nerves originate. So, and this nucleus pulposus, this is the prolapsed nucleus pulposus, this presses on this spinal nerve. So in this way the pain gets transferred to the lower limb. That's all. Okay.